The Ghana Health Service in November last year instituted the National Quality Assurance Program for COVID-19 testing laboratories to ensure accuracy of tests. The program was to ensure 23 accredited labs had the required human resource, follow the required protocols, and use standardized equipment to conduct the tests. But an assessment of the first phase of the program has revealed some of the labs were failing to meet the standards. Evelyn Anna, not her real name, had to do 3 tests at separate laboratories before she was confirmed positive.
First one was contact tracing, but I was told that when it's negative it won't come. So after 3 days, and then I started having slight headache and cold, and I was advised by my personal doctor that until I test negative, I shouldn't report to the office. So after about 4 days, I had to go to another hospital to test, and it was still negative. So basically I did 2 tests within a week, all tested negative.
The Ghana Health Service says a way of addressing the challenge is to raise the testing accuracy threshold to 80%. Professor William Kwabena Ampofo of the Noguchi Memorial Institute for Medical Research is coordinator for the National Laboratory Network for COVID-19 testing.
Some labs scored 100%, some labs scored, less than 70%. And this is of great concern. When you test for a pathogen, if it is negative, it is negative. If you get a false negative result, which means that the pathogen is there, but your result says it's negative, that's a problem for COVID. People will be walking around with a false negative result, but they're actually positive and they're spreading the infection. We have decided that if you are a lab, you must get at least 80%, and it should not be a false negative.
Another challenge the program identified in some of the laboratories was poor sample taking.
The way you store the sample can give you a positive or negative result. How long you store it, how you pick the samples when you get into the lab, how you process it, and your equipment. Even after you've run everything, interpreting the result. You could be interpreting it wrongly. A lot of effort has to go into providing detailed technical expertise.
The Ghana Health Service is hopeful the National Quality Assurance Program will ensure the least graded laboratories, through its assessment, will be equipped to improve. The service maintains it will not hesitate to crack the whip on defaulting laboratories which fail to meet the standards.